It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are changing people's lives. And you know, Jim, medicine has come so far. We're so advanced that just because you need a surgery or a procedure doesn't mean it has to be extremely invasive.
You're exactly right. And our first doctor, Dr. Robert Myles, has helped a number of individuals suffering from back pain with a minimally invasive procedure.
The goal is to become pain-free when you have a disc herniation or back or leg pain. What we do is we want to address it first without any type of surgery. We want to try and treat it conservatively, but if not, we want to use the newest and the best and easiest method that will take care of your problem. In Vincent's case, the minimally invasive approach was the best way to deal with his issue that he had.
And basically what he was wanting to do is just make an inch to an inch and a half incision, dissect down to the actual disc, and remove the bulged part and a little bit more of the disc to prevent any future herniations.
Minimally invasive surgery has changed the way we're doing spine surgery. It decreases your time that you spend in the hospital, decreases your pain, decreases your blood loss, and also decreases the time that you have to spend off work.
I have no regrets of doing this surgery whatsoever, because the pain that I was in to being pain-free now is amazing.
Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases, rarely, that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It is also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problem is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.
We are hearing a lot about the West Nile virus infection.
that you have is chronic Lyme disease.
I had been experiencing pain from my head to my toes, and I had been to numerous doctors, and I knew there had to be something different, something better, because I knew I couldn't live this way and I did not know what the pain was. I found Dr. Shaw in 2002. During our first visit, he asked me where my pain was, and I said, "There is not a place in my body that I do not hurt." And he said, "Well, fibromyalgia, you don't hurt from head to toe." I said, "Have you ever been tested for Lyme disease?"
Gloria had several problems. She had myofascial pain, she had joint pain, and still does. She had what we call neuromatous. She'd had some nerves operated on because of pain. She has severe headaches, and some of her headaches are vascular, similar to migraine.
I get to visit my family that live in Oklahoma. I can make an occasional car trip. I can do things that I didn't think I was ever going to be able to do again. He listens to every ache and pain you have, and because of the medications in his treatment plan, we have got to where I am today.
Several years after we started treating Gloria, one day she came in all smiles. And she said, for the last 2 weeks, I've not hurt at all. In someone that's had chronic pain for years, it's an incredible miracle.
During my visits with Dr. Shaw, one of the things that we have discussed is not only mentally, but physically, to achieve pain freedom. And each visit, I feel like we are getting closer and closer to that objective.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
This Friday, I'm going to have a gastric bypass. I chose a gastric bypass surgery because it has a higher percentage rate of reversing diabetes. And I would have loved to have done it by myself, but I need all the help that I can get. Because I'm looking at my lifespan and my quality of life. And if I don't put a stop to it now, then what does my life look like 20 years from now?
She's been overweight for a long time. She gained a lot of weight right after pregnancy and tried to lose that, wasn't real successful, and then she sort of became the caretaker for her mother. So she gained a lot of weight during that period of time.
I tried different diets and I tried some lifestyle changes without success. I'd get a little bit here, but then you'd gain it all back. And I became diabetic.
She's now trying to get back to being in better health. So she's been through the weight management program. She learned a lot about nutrition, and we've started her doing some exercise things. She's been to a psychologist and learned some more stuff about herself and how to deal with things, how to change habits, how to deal with stress with other things other than eating. It's really hard for people to lose weight on their own. It's really hard. And it's really kind of unfortunate because people look on the internet and they read blogs and things and they say, this guy, he lost 60 pounds in the first 2 months, and I think, oh my gosh, the guy's gonna die. But they think that that's wonderful because in today's society, what do we want? We want to be thin tomorrow, right? Oh, this is not gonna happen. It's not healthy to do it.
I'm looking forward to getting on a water slide, getting on the airplane without a seatbelt extender, getting on a roller coaster without thinking that the bar isn't coming down far enough and I'm gonna flip out. I am looking forward to climbing up the stairs without paying the fat girl tax. And this is gonna be great. This is gonna be great.
Pediatric flat foot is a deformity in which the arch of the foot is not normal in respect to when the patient is standing. Initially, when they're young, it may or may not be symptomatic, and that usually kind of determines whether or not what type of treatment we need to perform. If it's asymptomatic, that gives us a few more options as far as treating it conservatively with items such as custom orthotics or inserts for their shoes. And if it's symptomatic, then that leads us a little more towards possibly reconstructing the foot surgically.
I came here because I was born with a short Achilles and I had flat feet. It would affect how I would grow up and how I ran and all that, and it hurt a lot and just affected what I did physically.
When Justin came in, his parents stated that they were concerned because he was actually reporting pain along the inside of his foot. Due to that pain, he was not as active as they thought he should be.
They measured my feet and they did x-rays, and he told me to walk and all that back and forth and see how I walked and how my heel was doing.
Once they hit about 10 years, 12 years of age, if it is symptomatic, then you can actually do surgery to reposition the foot and prevent problems that usually go unnoticed until they're later in life.
I was tiptoeing and my feet was going up and I wasn't walking right. He had fixed my feet so well. I was walking and running better, and I was able to do sports and all.
One thing that's very important about this condition is that a lot of people do not have it treated because there's a belief that the child will grow out of the deformity. Although surgery is not required, if left untreated, they likely will require some type of orthotic or insert for their shoe permanently.
He's helped me change how I can do things and how I can run, walk, and do things physically. I'm pain-free since after he did the surgery, and this feels better.
The feeling of correcting someone's foot in this manner so that they are productive and happy and not limited in their activities is extremely rewarding.
And don't forget, for those who want to find out more information about any of the outstanding physicians you see on today's show, the place to go, Candace, is the website, bestdocsnetwork.com.
And now we're going to check in with our next best doctor. It's plastic surgeon, Dr. Robert Wilcox.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago, I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
I was having problems with incontinence, needless to say, and that's something women don't like to talk about. So it's one of those things you just really sort of keep to yourself, where you don't even talk to your best friend about it. This was something that, had been bothering me for a long time.
Genityte is a treatment for stress urinary incontinence, urgency incontinence, urinary urgency frequency issues, as well as rectal incontinence and rectal tone issues.
As a healthcare professional myself, I was actually researching procedures that were non-surgical that could maybe help alleviate some of the urinary symptoms. And then that's when I found out about Genityte and Dr. Carol Norton at Finer Touch.
You get to know where every restroom is in town, needless to say. But it's just, so this was something that, it takes control of your life. And to finally be able to say, I've got the freedom to, live like a normal woman should, without having to always plan for it.
The treatment is done in the office. It takes about an hour to do the procedure, and there are generally 2 to 4 treatments required. The number of treatments really just depends on whether or not we've reached the end point, which is resolution of symptoms, and you can actually see the tissue tightening. So we're looking for that tightening effect to hold between treatments.
You can't go to just any doctor and have this done, so Dr. Norton is just, right on top of the newest technology. And she's one of only like 4 doctors here in the U.S. that have been totally trained on this. So she, was so excited to hear about it.
Basically incorporates the use of an infrared technology to help tighten the tissue of the vulva and vaginal area in a way that's very natural to it.
Now I'm probably 80 to 85% of my symptoms are improved, and for me, that is wonderful.
I would say to any woman, if this is a problem that you're having, come talk to Dr. Norton in the Finer Touch, because you do have hope out there.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Don't forget, for more information on any of the great doctors you see on today's show, head to the website. It's bestdocsnetwork.com. Now, for those who are looking for the perfect smile, we have the dentist for you. It's Dr. Guy Lewis.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, over the age of 40, who a lot of times, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, and literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. What have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth,
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
A bunion is a bony deformity, a structural bony deformity that is painful with wearing any type of enclosed shoes. It's an inherited thing. Mom, Dad, Grandma, and Grandpa give that to you.
I had one of them surgically removed about 9 years ago. It was a very unpleasant experience. Long. The healing time was probably prolonged because of the treatment. So I put off getting my feet fixed.
The mechanics that cause the bunion quite often are associated with the same thing that causes the hammertoes. And there's different degrees of hammertoes. Jeannie came to see me complaining of severe pain. She had had bunion surgery a number of years in the past in a different state. And because of her experience there, she was very reluctant to have this current bunion looked at and taken care of.
My mom and I started looking and researching, and I just decided to pick Dr. Singleton. Liked his personality. He was very clear and concise about the surgery.
Bunion surgery usually involves the cutting of the bone and shifting the cut fragments over to realign the joint, to take the compression forces out of the inside of the joint. If you just take the bump off, that's where bunion surgery has in the past, I think, got a bad reputation. By just taking the bump off, you've done nothing to correct the mechanics that's causing the bump to develop in the first place.
The right foot's healed up really good. The left foot is well on the mend. I can wear my tennis shoes today. My mother and I just, I hit the ground running, and I mean to tell you, as soon as I could get up and walk around, I did.
It's really relatively soon after surgery for her to be doing as well as she's doing right now. She's been a fabulous patient. She's done everything we've told her to do, and that helps so much in a person's recovery after surgery.
So I achieved my goal through this surgery and coming to Dr. Singleton and the surgery that he performed, and I am enjoying pain freedom with my feet, able to do more.
Breast reduction is a very common procedure in the United States. The reason being is that there are many women in the United States whose breasts are larger than they should be due to hormonal responses in their body. And when the breasts get that large, it starts to become quite a problem for them on many fronts.
Ever since I was a kid, I knew I had big boobs. Initially, I thought it was very enhancing and I loved it, but then whenever a D got to an E, when an E got to F, when an F got to Triple H, and I was like, you got to be kidding me. Prior to having my breast reduction surgery, I had a very hard time walking around. Running was like next to impossible without actually being excruciating pain and feeling like I need to sit down.
Jennifer was one of the first patients that I saw here after I came to the area. She's a very nice girl who had a very common problem of having extremely large breasts, so large in fact that it really affected her daily life. She had almost constant pain in her neck and her shoulders. She found it very difficult to find clothes that would fit her appropriately, and she certainly couldn't do any type of exertional activities because of her very large breasts. I saw her here in the office. I found that she was an excellent candidate for a breast reduction procedure. We scheduled her procedure and we did her surgery. She was able to go home that same day. She did very well in recovery, and now she can do her daily activities without these constant feelings of pain around her neck and her shoulders. And I think that her quality of life has been improved quite dramatically by this procedure.
I have been able to be an active participant in my son's life. I'm able to go and join my friends out and actually not want to sit down every 2 or 3 minutes. It's unbelievable to think that a breast reduction can actually help you regain a sense of life, but Dr. Hermann helped give that to me.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are changing people's lives.
And of course, for more information and in these outstanding doctors you've seen on today's show, you head to the website bestdocsnetwork.com.
And if you have a question or comment for us, we'd sure love to hear from you. Just send us an email at info@bestdocsnetwork.com.
And don't forget, everyone, the Best Docs Network magazine is out, so check your local newsstand. So long, everyone. We will see you next week.